this is Angie Moore reporting from Tijuana, Mexico at the Holistic Care Clinic. Today I get to interview my most favorite doctor in the whole wide world, and I get to ask him some questions because I want other people to be familiar with Dr. Bergman and why I like him so much and why I'm here and spending a whole month or maybe more here. So Dr. Bergman, where did you study, what did you study, and what makes your method of chiropractic care better than others?
One of the cool things, I started late in life. I was a contractor, builder, had a cabinet shop, and I was hit by a car when I was 30. So I'm starting late. So I have this mindset of finding the problem and fixing it. And when I went to school, I had no knowledge of anatomy or physiology. So I ended up tutoring, and teaching and learning. And when it came to human dissection, it was like the world opened up. So that's when, I just fell in love. I ended up being a lab assistant and then being a guest lecturer for the next 8 years on human dissection. And then I started to tutor the different classes, and then I ended up taking extra classes. But the masters I learned from, these were not back pain, neck pain, because chiropractic has never been that. They were doctors of the nervous system. And then when I was instructor at Cleveland Chiropractic Los Angeles, which closed a few years ago, they sent us to the diplomatic neurology program, and so we could learn some of that. And so I grew up, in chiropractic, knowing that you could take an x-ray, do some therapies, take another x-ray to document that you actually fixed the problem. And knowing that I ended up teaching and tutoring 4 different techniques, extremities, and human dissection for years, I got a little bit different approach when it comes to anatomy, physiology, neurology.
Cool. So when you're adjusting the neck, like almost every single chiropractor does that twist. And now I'm afraid of that after listening to you. So what do you do different and why? And is that twisting action actually dangerous?
It's not if you're contacting, you know what you're doing, because heads can turn really, really far. Okay, that's not an issue. But if you want to correct the spine, you've got little sensors on the vertebrae, and the more you turn it, the more increased tone of that muscle. And if you're going to adjust someone, it's a heck of a lot easier to adjust with no muscle spasms than through a bunch of muscle spasms. They even call it a rotary break. And if people are adjusting you without an x-ray, that's crazy. So we do static x-rays, we do stress x-rays, we look at the entire structure before we even do the adjustments. But right now, the medical profession is trying to dumb down chiropractic, and so they're not telling chiropractors, you've got to take an x-ray to identify the problem. You should take a post x-ray to show that you actually fixed what you found on the first one. And you're not going to get good corrections by turning the head. If you just want to pop, beautiful. Get some of that packing paper. But if you want to correct someone, you better do a pre and post x-ray. Those people that are twisting the heck out of the head are not going to get good x-ray changes. Like we turn the head no more than 10 to 15 degrees. Yeah, Gonstead is also a really good technique that does that. Chiropractic biophysics, there's a number of techniques that do that, but they're not teaching this. They're electives at some of the schools, which is insane.
So really twisting isn't going to fix it.
Even when you're on your side, but doctors will twist the hip one side, twist the hip the other side, and then twist you even more. And no, I don't like that. There's multiple techniques that the body is in a neutral position, and I find it much more effective. And since we'll do post x-rays at 30 adjustments within 2.5 weeks, I have got to show structural and neurologic changes. So I find it much more effective not to twist the heck out of a person.
Okay. So you're here at the clinic in Tijuana where they have dental and medical with the IV treatments and hyperbaric chamber and all that. So what are the advantages of incorporating all 3?
No. Okay, this is cool. So on the initial exam, and you had that.
Yeah.
We do a CBC or complete blood cell count that gets like, little stuff. We do a live blood cell analysis, which shows the status of the blood. So in all the IVs we do, they only do two things. Either they're going to detox the system or put nutrients in. So that way we can get the body up so the blood is healthy, because every joint in your body is hydraulic. It needs fluid. And if the blood isn't healthy, it can't get into those joints to regenerate or to make that joint work effectively. So we have got to make sure the blood's healthy. Now, to regenerate the body, to reverse arthritis, you have to create a little bit of inflammation at the level of the disc or the level of the joint. Now, inflammation is a healing process of the body. The thing with inflammation, though, is it creates free radicals, and that free radical formation can damage healthy tissue. So antioxidants, like vitamin C, glutathione, deactivate, so it makes inflammation actually work and regenerate the body. And then we have tons of other nutrients, because, you've met patients with Parkinson's, neurologic damage, post-stroke. You've met, severely damaged people, and so depending on what damage has been done, we can give nutrients. Hyperbaric is fantastic for working with upper motor neuron lesions or brain issues. We've got light bed therapies. It's cool, but we do the post scans, post nerve scans, post live blood cell analysis to show if it's working.
Yeah.
I know. You saw your post blood.
Yeah, it was improving.
Okay, very nice person, beautiful blood. I'm just telling you right now.
Thank you. So, I can't even read that. Oh yeah. So it's really hard to find a really good chiropractor that really is effective, and they're missing out on things. So what are the things that you could tell, like maybe chiropractors, what are they missing out on that they should know? And is there any things that you have, like videos, to help chiropractors with what?
Yeah, we have full training programs, everything else, and we have chiropractors that are visiting all my clinics on a regular basis, so they can see how to do it. And we have a list of 7 questions. Do you take an x-ray? Do you take a post-x-ray to document the structural changes? Do you work on post-surgery cases? Because that denotes a level of skill. Okay, do you work on kids? Do you work on seniors? Can you reverse arthritis? And is your goal to restore the form and function, or are you just working on symptoms? You only need to say yes to 5 of the 7 questions. But we do after training. One of our teaching websites is adaptivephysiology.com. That's adaptivephysiology.com. Now, it's still, we're still populating it with thousands of videos, and it's direct for chiropractors. And we have everything from detailed hand position on adjusting a cervical spine that has post-surgery.
That they can learn online, or do they have to do it in person?
They can see it online, and they can come to my clinics and I can teach them, or we can do the seminars and they can do hands-on. So, for me, I can learn some stuff online, but I really got to try it with people. So, and that's why we even have a chiropractic map on there, that there are not many chiropractors on it, because they're not really teaching pre and post x-rays, particularly in Canada. I think they have Canadian red flag rules where if you're not getting results on a patient after 5 visits, then you shoot an x-ray, which in my world, that'd be negligence. That'd be criminal negligence.
Yeah. One chiropractor did do all the x-rays, but then after a year or 2, he put me on maintenance. And I thought, I was just thinking, so this is all there is? I can't get any better? Honestly. So one more question.
I hate that term maintenance, by the way. I like to measure stuff.
Yeah.
And then, what does someone need for maintenance? I've got some guys, this one guy, the 6 kids, MMA fighter, big in business. I'm going to see him twice a week for the rest of his life because he's such high stress. Got another patient who's a vegetarian yoga instructor who's independently wealthy. I see her about 4 times a year. Two totally different
Yeah.
maintaining their health. Yeah.
One last question. What can you tell chiropractic patients what they need to do, how to do their part? Because I know that people come to doctors or chiropractors and they think, this guy's going to fix me. But they have to do their part, right?
They do. And that's why there's always three things we have to address: physical stress, chemical stress, and emotional stress. Now, we give exercises for reprogramming the frontal lobe for anxiety, stress, depression, impulse control, schizophrenia, everything. So taking care and reprogramming the brain for emotional stress, and also visualization, we do that to take care of emotional. Chemical stress, that has to do with medications, diet, and sleep. Okay, so we teach people how to reset their circadian rhythms. And then the physical stressors, the adjustments are one, but we also, and I saw you doing the neck exercise,
Yeah.
which you were doing really, really good. We also give an exercise for sitting to restore the lumbar curve, for stretching the calf, for stabilizing the pelvis. So as long as, whatever the chiropractor is addressing, we're all on a three-legged stool: physical, chemical, emotional stress. You address all three of those, then the results are going to be guaranteed. They have to be.
It works for me. So thank you so much. I just love being here, and I'm supposed to go home on June the 6th, and I say supposed to because I just don't want to go home.
Well, I mean, the food down here and the people down here and everything are,
Yeah.
it's
The weather, the food, the people, the treatments, and I just feel better. Today I feel better than ever. I can stand taller and straighter than I have in years.
God bless you, dear. You're inspiring. You
And
really are.
you are. You're amazing. Thank you so much. I just love you so much.
God bless you, darling.
As I mentioned, I'm really happy to be here. I couldn't be happier. And I've told the clinic about the Natural Health Library group, and they've offered to give me a code that I can share with my members, Angie Health. So anybody that comes to the clinic and mentions this code, you can receive a completely free consultation in the medical area of the clinic. Plus, if you purchase a dental service worth at least $200, you can get a free dental cleaning. And if you purchase the first chiropractic package that I did for $350, that's already an amazing deal. And if you do that, you can get a vitamin C therapy or ozone therapy for $50. They're both worth at least $120. So that's less than half the price. So just mention the code if you happen to come here and enjoy the benefits and experience and the relief and happiness that this clinic has to offer. Thank you.